Hello everyone, I'm Greg Humaneski, Senior Vice President of Human Resources. As you're aware, it's time once again for our annual benefits enrollment. This year we have good news to share with you. We have found ways to keep the per paycheck deduction for a health care plan to a low 3% increase for most coverages as compared to last year's 18% increase. And to help you manage your costs for health care throughout the year, the new changes to our health plan will reward consumerism by encouraging cost-effective use of health care resources. For example, visiting our doctor during regular office hours instead of relying on after-hours emergency care will make a huge difference in both out-of-pocket expenses and our future health plan costs. In fact, financial incentives in this year's plan will strongly favor use of cost-effective health care. These changes include increased use of coinsurance instead of copays, deferring more of the cost to the employee who uses higher cost services. Let's take a moment to talk about the health care plans we're offering. Again, this year, you can choose between our Consumer Choice PPO plan by Luminos or one of the Cigna Core plans based on your geographic location. Right now, I'd like to share some of the feedback we've received from several employees who are participating in our health care plans.
I looked at several of the different opportunities offered by Zales Corporation for health insurance, and I determined that my needs were best met by the Luminous package because it is important to have a program that is going to be there every day whenever I need something, because something can always happen. And by enrolling in Luminous, I have a health savings account which will cover me in the event of prescription or injury. You never know when something's going to happen, but this Luminous program really does provide peace of mind that makes me feel better about day-to-day life. When considering a healthcare plan, the most important factor for me was the cost. The Luminous program is very affordably priced, and with the health savings account, the ability to accumulate my health savings dollars over time, I really found that to be a win for me when I did have to go to the doctor for a health-related issue. And it was very simple, it was very convenient. I showed them my card, they made the necessary copies, and I ended up paying only about 15 to 20% of the total cost, which made it very affordable for me. It made it easier to manage my monthly budget, and I didn't have to pay anything out of pocket for something that was mandatory and essential. This year I would choose Luminous again. I'm very comfortable with the services that are provided, and I'm very pleased not only with the pricing, but the fact that I can roll over all of the money that I have not used this year into next year's account, which will provide better service for me as the years go on.
I would definitely choose Luminous again this year because it does give me more access to make the decision on my own healthcare provider. And you're able to go online and check out all the different doctors and prescription drugs, whatever. So many other health protection plans out there are so managed, and I like the flexibility that I get through Luminous.
Whatever plan you choose, what's important is that you select the one that works for you. Either way, you'll have a new choice in dental plans. In addition to our current dental PPO plan, we are offering a new dental HMO plan in most locations. Also new this year is a 3-tier pharmacy plan by Cigna to help you control your prescription costs. In addition, you'll have the same great vision plan we offered in 2003. More good news, we have a brand new online benefits enrollment process that's much easier to use. It's called ZEST, the Zales Enrollment System, and it's now available through ZNet, our Zales Corporation intranet site. However, for those of you who don't have intranet access at your work location, ZEST is available to you via the internet, which you can access at home or at your local library. And of course, your benefits enrollment forms are included in your open enrollment packet. Remember these dates, February 20th through March the 5th. Those are the dates when you'll be able to make your healthcare enrollment selections. which will take effect April 1st. You will also see the deductions for your new health care plan begin with your April 1st paycheck. In the meantime, become an educated consumer and carefully read your open enrollment packet so that you can make informed decisions. When it comes to health care, it's all about being a smart consumer. In fact, one of the best ways to keep our benefits expenses to a minimum, both now and for the future, is everyone's commitment to making informed, cost-effective decisions whenever we use health care services. It's your choice.
Last year, Zales Corporation introduced a new healthcare option, a consumer-driven health program from Luminas. Because of the positive response from employees who chose the Consumer Choice PPO option, we're pleased to offer the program again this year. Luminas is called a consumer-driven health program because it gives you, the healthcare consumer, more say about your healthcare decisions and dollars. With the Luminas Consumer Choice PPO, you're in direct control of a portion of the money used for your healthcare. You decide what healthcare services you receive, and you choose what doctor to use. And you don't need a referral to see a specialist. Plus, you'll have the opportunity to save dollars from year to year to reduce your future out-of-pocket costs. The Luminas program includes these components: a health savings account, or HSA, a reimbursement account funded for you by Zales Corporation; traditional health coverage that is similar to a typical health plan; a separate benefit to cover the cost of nationally recommended preventive care services; and the Luminas Health Toolkit. When you enroll in the Luminas Consumer Choice PPO, you'll have a health savings account set up for you and your family. Each year, Zales will place a certain dollar amount in your HSA, depending on your level of coverage. $500 for individual coverage, $750 for coverage for yourself and a spouse, or yourself and children, or $1,000 for family coverage. The Health Savings Account, or HSA, is like a bank account for your healthcare expenses. You can use your HSA dollars to pay the full cost of covered services with no copayments, deductibles, or other out-of-pocket expense for you to pay first. Your HSA can be used for routine medical expenses, including office visits, prescription drugs, lab tests, and other covered services. And with Luminas, you can choose any healthcare provider. However, more than 375,000 doctors and thousands of pharmacies and hospitals across the country offer discounts to Luminas customers to help make your dollars go further. If you don't use all the money in your Zales-funded HSA, the remaining funds roll over to the next year, so they're available to reduce your future out-of-pocket expenses. If you do use all of your annual HSA allocation, you're then responsible for a limited out-of-pocket amount called the bridge. The bridge is paid only as you incur additional expenses. The bridge amounts differ by the level of coverage you have. There are 3 ways you can pay the bridge. First, you can use any pre-tax funds deducted from your paycheck for a flexible spending account to fund the bridge. Or after your first year in the program, you may have dollars remaining from the previous year's HSA allocation to help reduce what you may have to pay. Or you can pay out of pocket, just like you would pay a deductible with current plans. Once you have used your annual HSA allocation and you have paid your entire bridge amount, you and your family have additional protection under the traditional health coverage component of the program. This additional coverage is similar to a typical health plan, paying for a percentage of the cost of covered services. There's a limit on the total amount you will have to pay out of pocket in any year. If you reach this limit, the program pays 100% of any further covered expenses for the rest of the year. The limit differs by the level of coverage you have. In addition to your HSA and traditional health coverage, you have a separate benefit that covers the cost of nationally recommended preventive care services up to $500 per person per plan year. These include immunizations, mammograms, and other preventive services. And using your Luminos program is easy. Just ask Mary Jones. She's a healthy 25-year-old who exercises regularly. During her first year with Luminos, Mary had a preventive care visit, including lab tests, an office visit for a cold, and a prescription drug. A total of $350 in expenses. Her preventive care benefit paid for $150 of the expense, leaving $200 to be paid out of her HSA. At the end of her first year, she was able to roll over $300 to year 2. That gave Mary $800 in her HSA for year 2. That year, her expenses were higher, about $450. That still left $350 to roll over for year 3. Savings she could use to help reduce her out-of-pocket expenses, like funding her bridge if she uses all of her HSA funds during the year. The Luminos program also gives you a variety of health improvement support programs to help you manage your healthcare dollars and decisions. Some of these services are available by phone, including a 24-hour nurse advice line and a service called the Personal Health Coach that provides one-on-one assistance from a registered nurse if you are managing a health condition that requires ongoing attention. Many more tools are available online. For example, you can go online to find doctors who offer Luminos discounts, learn what to expect before a doctor's visit or hospital procedure, compare medical and prescription drug costs, or look up your HSA balance. If you don't have online access, you can always contact a Luminos customer service advocate. They would be happy to share much of the same information with you via phone. As you can see, the Luminos Consumer Choice PPO is not a typical health plan. And that's exactly why Zale is offering this program to you. Whether you want more control and fewer restrictions, or you're simply looking for a more affordable way to cover your routine health care, the Luminos Consumer Choice PPO program may be just what you need.